This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. We have an awesome episode, one of my favorite topics. The title of this episode is Whitening as a Gateway Service. I'm going to share all kinds of tips to help you fully achieve the whitening potential within your practice. Hey, before we get to that episode, though, a couple of announcements. First of all, coming up shortly after publication, about a month after, we have our next masterclass. This is the $2.5 million practice model masterclass. It's on March 30th. That's a 3-hour course, 7 to 10 p.m. Eastern time. And as the title would indicate, that masterclass is all about the $2.5 million practice model. I'm going to essentially provide you a blueprint of all the necessary components and what that looks like and how to achieve it. And that $2.5 million practice model is not meant to be a cap. You can certainly take the information, develop a practice even further. So it's not meant to be a cap, but it is a great practice model because it truly can be described as a thriving practice, one that provides personal, professional, and financial satisfaction. It's also a practice model that will allow you to achieve an effective work-life balance. So it's not only very financially rewarding, but it's also a practice that can lead to an effective work-life balance. If either of those goals is of interest to you, come join us for that March 30th masterclass. You can go to thrivingdentist.com /masterclass to register. We do limit attendance because I run it more like a workshop than a lecture. If you're interested, sign up. Very inexpensive. Tuition is less than $100. You get 3 hours of CE credits. Lots of useful information that you can begin to use the very next day. Hope to see you there. The second announcement I have is we have a new guest contributor for our Thriving Dentistry Clinical Tip. She is Dr. Fran Brailsford. She's in private practice in London. And Dr. Brailsford has some great tips on how to gain maximum bond strength to dentin. Dr. Brailsford has a practice in London that focuses on biomimetic dentistry. Another way to think of biomimetic dentistry is advanced adhesive dentistry. And she's got some great tips for you. Without any further ado, here's Dr. Fran Brailsford.
Hi everyone, my name is Fran Brailsford and I work in private practice here in London. Thank you to the Thriving Dentist team for inviting me on their clinical tips series today. My work is primarily in restorative dentistry. I have a special interest in biomimetic or bio-inspired dentistry, so I take that kind of approach to my day-to-day work. This kind of dentistry can also be described as advanced adhesive dentistry. And in these kind of advanced adhesive cases, and indeed for any adhesive restoration, the success of them relies heavily upon achieving maximum bond strength to dentine. The initial prepping stage then, the substrate control, becomes the most important stage. How can we know what bond strengths we can achieve without knowing what substrates are present? What are we bonding to? Now, I was always taught, as I'm sure a lot of us were, to use a dental probe to decide upon the extent of caries removal in dental school, where the end point where we stop removing decay. But what exactly does hard to probing mean? And can we visually decide whether the DJ is clear or not just from looking? I think this method is far too subjective, particularly for the results we're trying to achieve with adhesive dentistry nowadays. Hard to probing could mean very different things from dentist to dentist, from case to case, or even if we have an older, blunter probe on one of our trays for one case. I always say this little anecdote when I'm talking about caries management from dental school, and it's not to say that we were naughty students, but I think we were thinking more about whether this was too subjective a method even way back then. And on clinic, sometimes when we were prepping teeth, we would be told, oh, you've still left a bit of decay there, go back, do a little bit more prepping there, please. And we would sometimes test the tutors and deliberately not prep any further there. Not sure what that says about us as students, but sometimes the tutor would come back and just say, oh yeah, that's much better, carry on. And I'm not saying they didn't know what they were doing, but that just shows what a subjective method that is when, even with the same clinician, same eyes, same case, 5 minutes later or after a coffee, they would have prepped things differently. So I prefer to use a caries detecting dye to take out the guesswork. It's a no-brainer day to day, I think. It's a cheap, quick and foolproof, if you like, way of managing caries in the cavity. I'm always saying the same little thing on my Instagram page all the time, which somehow is following me around now. The dye don't lie. So it's a caries detecting dye. My favorite is the pink one, bright pink from Cure. I prefer the contrast of that one against kind of those older stained dentine below failing old amalgams to some of the darker shades. There is one that's a green colour that I think is just a little bit too similar. I like the contrast of the pink one. Now, the dye stains denatured collagen a pink colour. Affected caries is a lighter shade of pink, and infected caries is stained a deeper hue, a more of a red, deep kind of colour. You scrub the dye in for 10 seconds and wash it away. It will show you the different substrates present, so caries, sound dentine, sound enamel. And you repeat that dye application after every time you're prepping until you can see that you have a clear periphery of non-stained, so sound dentine, sound enamel. And you're just removing just enough in these kind of safety zones, I'll come into that in a second, to avoid perforating the pulp. Those deeper kind of lesions, you may have to leave a little bit of infected or affected caries, but that is selective caries removal as we know it today. Now, it's very sensible. I always think actually to safely use caries dye, because you're not trying to just pop it in and remove everything, it's very sensible to read the David Alleman and Pascal Magnier 2012 paper about these caries removal endpoints before you get going with it. It shows you how you can use precise measurements and anatomical knowledge of the tooth alongside using the dye to guide your selective caries removal. And I will ask the team to make the paper details available to you in the notes section.
Hello, everyone. Welcome back to the Thriving Dentist Coaching in Action segment. This is Naren, your co-host. First, I want to take a minute to thank Dr. Fran Brailsford for that wonderful clinical tip. We really appreciate you, Dr. Brailsford, for joining us from England and sharing that great tip with us. Now, let's jump into
Naren,
today's...
just for the record, I could listen to Fran talk all day. I love her wonderful English accent. And of course, she would tell us that we're the ones that have the accent. But in any case, Dr. Brailsford, thank you so much for contributing. And I know our listeners are going to benefit from your information. Thanks so much.
Absolutely. The topic today is whitening as a gateway service. Whitening as a gateway service. Gary, I have the privilege of watching you in action with your coaching clients. And I know this is something that you work with your coaching clients on. And many clients, I'll let you, fill in the details as we go through the coaching clients, have seen their cosmetic part of the practice grow because of your strategy of using whitening as a gateway service. So I'm really looking forward to our conversation today about, what this means and how to leverage the strategy to grow your practice.
Well, this is one of my favorite topics, and I'm excited to share this information with our listeners. Let me start by perhaps framing the public appetite for whiter teeth. So recently, there was a survey done in downtown Chicago, And it was 6,000 people just walking by participated in the survey. And the question was, if there was one thing that you could do to improve your smile, what would it be? And Naren, 85% of the respondents said the one thing that they would do to improve their smile would be, wait for it, whiter teeth.
Right.
Imagine that. 85%. Now that's crazy, crazy response. Wouldn't you agree? In terms of, the one thing they wanted was whiter teeth. I think that demonstrates.
I don't think there's anything in dentistry that gets to that close to a number, right? 85% of the people wanted.
And by the way, just for a kind of statistical reference, 6,000 people were surveyed. That survey had an accuracy to plus or minus 2%. So when you ask that many people, it's a very valid survey. Now, let me kind of put this in context. Not every dental office, in the world offers whitening. I have statistics from the U.S., so I know we have listeners all over the world, but I'll use statistics from the U.S. Not every dental office in the U.S. offers whitening. There are some that don't. Of those that do offer whitening, the average number of whitening procedures is 1.2 whitening procedures a month. 1.2 whitening procedures a month. Now, again, let me put that in context. Naren, 85% of the people in the world want whiter teeth, according to that survey. So I'm going to use some simple math to demonstrate the demand or the interest in whitening. If an office sees 20 patients today, 20, and I'm just picking a number that allows me to do my math easily, 20 patients, that would be between the doctor's schedule and the hygiene schedule, 20 patients. And I'm not suggesting that's a good number or a bad number. I'm just making a mathematical analysis.
Right.
If 85% of those 20 people want whiter teeth, how many people a day are interested in whiter teeth, Naren? 17. 17. Okay. Now let's say hypothetically that that practice is open 4 days a week. So on average, they're open 17 days a month. So we have 17 people a day that are interested in whiter teeth times 17 work days in the month. That's 289 people, if they're all unique people. 289 people during the month are going to be interested in whiter teeth. And if the average office does 1.2 whitening procedures a month, can we agree that that's pathetic? I was going to try to frame it. I was going to try to frame it differently, but can we agree if that's pathetic? If we're doing, let's round 1.2 down to 1. You're doing one whitening procedure a month when 289 people statistically want whiter teeth in your practice.
Right.
I would say we're missing the mark.
100%. So it's like you're getting 7 out of 100 points. So that's like a fail. You're
providing the one whitening patient a month that begs you for it.
Right.
That's it. Now let's step back and look at this kind of from a comprehensive view. I'm not interested in whitening for the business aspect of it, for the revenue side of it. It's not going to amount to much. So, think about what we charge for whitening. It's not going to amount to much. But what I really like about whitening is that it's a gateway service. It creates interest. It creates a better patient. There's data that shows that if a patient is whitening their teeth, they become more interested in their mouth. As a result, they do a better job of their home care. They're more likely to keep their hygiene appointments because they're more interested in their mouth. And they become more interested. Now, they might say 6 months later when you see them, hey, doctor, I love the color of my teeth, but what about this? What about that? What about this? I noticed my lower teeth aren't as straight as they could be. Is there anything I can do about that? So they bring it. It's a gateway service. It creates interest in everything else we do. And it creates a better patient, a more compliant patient, a patient that's more likely to keep their appointments. Plus, from a very simple business principle, Naren, is the idea of giving, I'm going to use business terms now, I'm going to call the patient a customer in the case of using business, is giving the customer what they want generally a pretty good business principle?
Oh, absolutely. I mean, why Why not, right? Because if you don't give them, they'll go find somebody else who will give them what they want.
Give them what they want. They want whiter teeth. Let's give them what they want.
What they want.
All right. I want to share 5.
And the other thing that I was thinking, Gary, as you were speaking is, I mean, this point that you made, it makes them think about their oral health, their smile, their appearance more seriously. It's almost like you take baby steps. It's like a child who starts swimming and now he or she can swim 10 feet. Now he wants to figure out, how do I swim, a whole length, and then maybe 10 lengths, and maybe now, swim in the lake for like a couple of miles.
It starts that first domino falling.
Exactly.
Yeah, we've all played dominoes. You know what happens when the first domino falls? It starts the whole train of dominoes falling. And the dominoes falling in this case are patients taking a greater interest in their mouth. And I'm sorry, guys, but that is an absolute winning strategy in your practice. So I want to share some specific tips that will help grow the whitening business in your practice. All right. Tip number 1. Start by taking a shade match of your hygiene patient. Your hygienist will take a shade match at the beginning of the hygiene appointment. So we take a shade match, and it goes something like this. I'll role play as if I'm the hygienist, Naren, and you're my patient. Hey, Naren, I'm going to do something a little bit different at the beginning of our hygiene appointment today. I'm going to start by taking a shade match of your current tooth color. And the reason we're doing this now, Naren, is that we know that tooth color changes over time. It tends to darken with age. I'd like to have that for our records. And we grab a Vita shade guide and we take a shade match. By the way, that shade match should take about 15 seconds to take. So then I go to tip number 2. Once we have the shade match, I now show it to the patient on the Vita shade guide, organized chromatically from dark to light. So we organize that shade guide chromatically. And now I'm going to say, hey, Naren, let me show you the current tooth color that you have here on the shade guide. I've organized this from dark to light, and you're about right here. Now, trivia question. What is the average adult American's tooth color on the Vita shade guide if they've never had their teeth whitened? It's A 3.5. A 3.5. And for those of you that know what the chromatic ordering of the Vita shade guide looks like, if I look at that, it's ordered 2/3 of the way down the scale towards dark. So now we simply show the patient, hey, Naren, I just want to show you where you are. I've organized this from dark to light. You're about right here. And again, that would be 2/3 of the way down the scale. What do you think most people are going to say when they see where they are, where their color scale is? What do you think most people will say?
I think, do they underestimate or overestimate where they are?
Wow, I could get whiter teeth, couldn't I?
Right. So they're always looking at what's missing, right? What they don't have.
Yeah, they want what they look at what they want.
Right.
And now when they see where they are compared to what they could have, they want this. Right. They want it. And then we can simply, it's a door opener. It's an icebreaker. Hey, Naren, just so you know, we have 3 forms of whitening here in the practice. If you'd like us to do the whitening for you, we can do it chairside. We also can make custom trays that you can use at home. We can provide you with the material to do your whitening at home. We also have a simple, inexpensive whitening product that is available here in our office that you can take home. It's very simple. It's very inexpensive. It's only available in a dental office. And that's an option as well. If you have any interest, let me know and I can walk through with you what might be the best option for you. So tip number 3 is I do think it makes sense to offer 3 forms of whitening in your practice. A chairside whitening option, something that you do for the patient. A couple of options that kind of come to mind would be Philips Zoom using the lamp. Ultradent has a great product for chairside whitening as well. They call it Boost as well. I like Ultradent products an awful lot. So we can do chairside whitening. A second option would be custom trays, where we do take-home trays. Again, some options there. Again, sticking with the 2 chairside options I've presented, we can continue to use the Philips Zoom products in take-home form. Those are available, night white, day white, and also Ultradent opalescence products can be done for take-home trays. Again, if you have other vendors that you like, use the flavor that you prefer, for sure. And then for a simple, inexpensive over-the-counter product, I like offering, again, I'll stick with Ultradent here, their Go product. Go is prefabricated trays. It's a dual tray setup where the patient pops the two trays into their mouth. It comes together and they pop them in their mouth. Then once it's in the mouth, they take out the outer tray, which leaves a very thin inner tray that's been preloaded with gel. It's called Go. It's a fantastic product. One of the things I really like about Go is that Dr. Dan Fisher, the founder of Ultradent, dentist, a wonderful, wonderful human being, a great dentist, an amazing human being. When Dan came up with the Go product, he had an opportunity to put that in retail stores. Put it in Walmart, put it in Target, put it in all the, Walgreens and all the drugstores. He chose not to do that because he wanted whitening to be professionally supervised. And I have to give Dan massive ethical credit for that. And I agree. I think whitening should be professionally supervised because, for example, Naren, if you have any decay, that perhaps is not you're not experiencing any pain, but you have decay, we're going to want to get that decay taken care of before we do whitening. And so that's not going to happen if you can just go to Walgreens and pick up a whitening product. So I think the idea of having it professionally supervised is a great result. All right, third tip, offer 3 forms of whitening. Tip number 4, consider offering lifetime whitening. Now, stick with me on this for just a minute. For our chairside whitening, we're always going to make a set of custom trays so they can continue the process at home. And of course, for our take-home trays, we make a set of custom trays. So those patients are going to have a permanent set of trays. This doesn't apply to Go because those aren't permanent. Those, after we put them in the mouth, they're disposable. They're not permanent. So if the patient has a permanent set of trays, we offer lifetime whitening. And what that means is, as long as they keep the recommended hygiene appointments, we're going to give them free gel so they can continue to touch up whitening after their hygiene appointments. And I like to get the syringes from Ultradent. Dan puts anything he can in a syringe, and he puts the whitening product in a syringe. It makes it very easy to load the trays. When the patient, as long as they keep their recommended hygiene appointments or give us 48 hours advance notice if they need to change it, they stay in our lifetime whitening program. So offer lifetime whitening. You're giving people what they want. One syringe will typically be useful for 4 applications of the trays. For most people, that's enough to get a nice kind of touch up on their whitening, at least for most people that have a relatively moderate food or drink habits on food or drink that causes stain. Coffee, tea, anything that would stain a white shirt will stain people's teeth. Now, if someone has more aggressive coffee habits, like they drink 3 or 4 cups a day, or tea, or they enjoy spaghetti multiple times a week, then we'd provide them with 2 syringes, 1 or 2. If they want more than that, then they can buy those from you at a price that you determine. And then finally, tip number 5, consider value pricing whitening. It's the only service that I recommend to my clients that they value price. But consider value pricing, because the concept of value pricing is if you make it less expensive, you'll do more of it, and it'll lead to more gateway patients for us. So rather than trying to use it as a profit center, which as a business person I am in favor of, I would rather value price it so we can do a lot more. For example, recommended pricing, again, you can decide, but I'll share with you when clients ask, hey, Gary, when you talk about value pricing, what do you mean? I would say for your chairside solution, make it something less than $300, $297, for example. If you do Zoom or you do the opalescence boost, that will be considerably less expensive than it is in other dental offices around your area. It's still profitable at that, marginally. You're covering your expenses, really. As far as take-home trays, I'd recommend $100 less expensive than chairside. So if you're doing $297 for chairside, I would make that $197 for custom trays. And then if we're offering the Go product, it comes in a box of 10. You pay $32 for that box. And I would suggest that maybe a value priced for that box of 10 would be $50, Aaron, $50. So $297, $197, and $50. And I believe by offering those price points, you literally have a price point for virtually anybody in your practice, And now you might ask, Gary, what would be an appropriate goal then? And let me tell you where I would like you to get. And this is what I shoot for with my clients. I'd like you to get to the point where you're doing one whitening procedure a day, a work day in your practice. So if you're working 20 days a month, I'd like to see us get 20, whitening patients. And by the way, any of those three counts. It counts if we do chairside, counts if we do take-home trays, and it counts if we hand them a box of Go. All those count. And my goal would be to get to 20. But Naren, if the average is 1.2 whitening procedures a month, do you think we're going to go to 20 overnight?
No, we are not. So I think it's better to start smaller, right? That's a big jump from 1 to 20.
And I might argue that that's too big of a jump. It's not that you couldn't do it, but it's not very likely. But start somewhere. And where I'd encourage you to start is somewhere between 5 and 10 whitening procedures a month. Somewhere between 5 and 10. If you're the kind of person that likes to have a stretch goal, start at 10. If you're the kind of person who wants to have a safe goal, start at 5. And if you're in between, pick an in-between number. There you go. So to recap really quickly on those strategies to really grow your whitening business. Number one, start by taking a shade match at the beginning of the hygiene appointment. Let the patient know what their tooth color is. The language we use is, Naren, because we know that tooth color changes over time, and it tends to darken with age, I want to go ahead and take this shade match so we have it for our records. By the way, if a patient shows zero interest in whitening, then make a note in your electronic chart and don't bring it up again. We're not going to beat them over the head with it. We're not going to try to pound a square peg in the round hole. If they're not interested, make a note of that and don't pester them. Tip number 2, show them what their current tooth color is on the Vita Shade Guide, organized chromatically from dark to light. Tip number 3, come up with 3 forms of whitening in your practice: a chairside for people that want you to do it for them, custom trays for people that want to do it on their own at home, do it yourself. And option number 3 is an inexpensive over-the-counter option available from your front desk. What I really like about the Go product is it's not available anywhere else, only available in a dental office. So it remains professionally supervised under your guidance. Tip number 4, offer lifetime whitening. Remember, lifetime whitening, as long as they keep their recommended hygiene appointments or give you 48 hours notice if they need to change it, they're going to get lifetime whitening. They're going to get free whitening as long as they're a patient in your practice. We're going to give them 1 or 2 syringes, and that's enough for most people to get a nice touch-up on whitening. And a good time to touch up is after their hygiene appointment, because now their teeth are nice and clean, and they'll respond very well to the whitening. And tip number 5 is consider value pricing whitening as a way of making it more accessible, more available, and you'll see your numbers go up. And as a result of this type of activity, I'd like you to get to the point where you're doing 20 whitening procedure or 1 whitening procedure a day in your practice, but start with a goal of 5 to 10 whitening procedures a month. Naren, we've got some great questions that have been pre-submitted to us by our listeners. Let's hit pause here in the Coaching in Action segment and get to the Thriving Dentist Q&A segment.
Welcome back to the Thriving Dentist Q&A segment. Gary, I have 4 questions for you. I really enjoyed the Coaching in Action segment today, Gary, and the topic whitening as a gateway service, I think, is going to be one of those topics that probably a lot of people will play in their meetings and probably learn from. So thank you for that. The first question I have for you is, we do very little whitening in my practice, and I think one of the reasons for this is that we have not seen great results with our current whitening products? Any recommendations?
I'm so glad, Doctor, you asked that question. I have encountered this in my coaching, and I've encountered offices that just can't seem to get the whitening, off the ground. And as I've visited with team members, I try to get to the root of this and say, what's up? How come we're not getting any traction on this? People want it. And I've often discovered if offices are kind of underperforming in whitening, they don't have a whitening product they believe in. They don't have one. And, imagine a hygienist or a dental assistant that doesn't believe in what it is that you're offering.
Yes.
What's going to be the natural behavior around that?
They're not going to be, patients can feel it, right? They don't believe in it. So patients know that it's perhaps not a good choice.
Yeah. They aren't going to be comfortable talking to patients about it. And so my tip would be, Doctor, work with your team to come up with whitening products that you believe in, that work well in your hands, as they say. And you might ask your dental assistants to do some research. They can do that online, or they can maybe do it through your reps. Or if you're going to a conference coming up, you can check out the vendors, but get some products, test them with yourself, and agree as a group. Hey, this is what we're going to do. These are our products that we believe in. You're not going to get any traction on this if they don't believe in it. And so stick with it, and find there are great whitening products out there. But again, in terms of you want to have it be tuned into your practice and what your team members believe. Practice whitening each other, and stick with the ones that work well in your hands. And once everyone believes in it, I think you're going to find a whole new world of opportunity open up, because team members are going to be wanting to talk to your patients about this, where in the past they've been reluctant to bring it up, so they just didn't believe in it.
Thank you, Gary. My second question is, what is the best way to market whitening to our community?
Well, Naren, certainly we can do some things, internally in the practice. And then I'm going to turn to you, and I'm going to ask you to put your marketing cap on and talk about how we could market through organic search engine optimization. But some things you can do in the practice, for example, is have the idea of whitening promotions throughout the year in a seasonal kind of format. As we're recording this, Naren, it's early February, and our next holiday coming up, if you go into any of the grocery stores, is Valentine's Day. And we could have a kind of a seasonal promotion that goes around the year. So maybe we do a promotion around Valentine's Day, where we offer whitening gift certificates, to our patients. Maybe as we go through the calendar, the next would be Easter. Look your best, for when you're wearing your Easter finest. Complement your Easter finest with a beautiful white smile. Maybe Mother's Day comes next. Father's Day and graduation comes next. Even 4th of July, midsummer, when people are outside and they're benefiting from suntans. They might want to have white teeth, and we could go into the fall, with that as well. So certainly we can promote it internally. Naren, talk about some things in keywords and organic SEO that we can do when it comes to whitening.
Absolutely. And I do second your premise, Gary. This once your patients and your potential new patients get interested in whiter teeth, they're much more interested in all the other services you provide, whether it's on the health side or on the cosmetic side. So it's a great keyword, and we work with a few hundred clients, and almost every single one focus on teeth whitening as part of their SEO strategy.
How many different ways can we say teeth whitening?
At least 35 to 45 different keywords is what I have seen. Of course, what I mean is these are not single words, but rather phrases. So it could be, whiter teeth, Chicago, whiter teeth, zip code, whiter smile. I mean, people type all kinds of crazy things. They might even type the name of a product.
Now, there's a term that I don't particularly like to use, but the public might use it, and that's the term bleach. Bleach. I'd rather use the term whitening, just
right.
Personal preference. But let's not get caught up on our language.
Right.
Let's use the language that the patient uses. How can we find out what the language the patient uses?
Absolutely. So, we produce a monthly report and we get data from Google Analytics. So Google Analytics will tell us literally, here are the 45 keywords and phrases related to whitening. And this is how many people who type in each one of those keywords and phrases. And this is where they see your practice on average. So let's say a particular keyword, why a smile, 60616, that's a keyword. And Google Analytics will tell us, okay, 39 people typed it in the last 30 days, and your average position is number 3. That means these 39 people on average saw you as the third result. So that's a great tool. So you don't have to guess, you don't have to know. You can literally see what people
actually just go to the source.
Exactly.
Now let's get a little bit more abstract, Naren, and talk about phrases. And I'm going to start, and I want you to let's you and I go back and forth and maybe come up with 4 phrases. One of the ones I'm going to suggest that the public might use is, does teeth whitening work?
Yeah, absolutely. Another phrase might be, teeth whitening for coffee.
There you go. All right, I'm gonna give another one. Does it hurt to have my teeth whitened?
100%. Another phrase could be cost. How long does teeth whitening last?
There you go. So you can see that these phrases can now be incorporated. Now, Naren, if you were the marketing firm for your client, then you'd put those phrases into the copy of the website.
Correct.
So there'd be a way to incorporate that organically into your whitening pages, but you'd also code it in the HTML code behind the curtain so that the coding is picked up as well. And so you'll likely appear on page 1 when someone types in those phrases.
Absolutely. Plus, we'll pay attention to the 6 things that Google cares about to determine, are you going to be that 5%? I know you and I have talked about this before, 5% of the dental practice owners who are going to get 95% of the free traffic. So all the other things that you need to pay attention to for, SEO dominance, you need to pay attention to if you also want to dominate for, teeth whitening.
Right. Thank you, Naren. Great suggestions for digital marketing and using Google to supply you with whitening patients.
Absolutely. And if anyone is interested in finding out how well you're doing with SEO, just in general or with whitening, you can book a marketing strategy meeting. We'll add a link. It's complimentary. It's equa.com/MSM, which stands for marketing strategy meeting, ekwa.com/MSM. It's a 90-minute meeting. We spend 6 hours doing research. We'll tell you how you're doing and what you need to do to, dominate SEO in general and for teeth whitening.
Oh, and by the way, we just talked about it in terms of whitening, but if there's any service that you want to drive in your practice, let's say adult orthodontics or cosmetic dentistry or treating TMD, TMJ patients or complex restorative, any of that can be done in the same way that we just talked about whitening with the application of those keywords and key phrases as well. It's literally a science now. It's not just throwing a dart against the wall and hoping it sticks. It's literally a science.
Exactly. Let me ask you the third question, Gary. I really like your idea about offering lifetime whitening, but I'm concerned that it might be difficult to administer. Can we do this without it becoming a burden?
Great question. And, I think sometimes we're quick to think about, all the things that can complicate things. And we don't want to get into something that's going to make practice more complicated. But what I tell my clients is, doctors, you don't need to administer any of this. Simply empower your business team members, because it's the ones on the phone. Could be your hygiene scheduling coordinator, could be your doctor scheduling coordinator, your admin team members. Empower them to decide and let them just ask them, treat the practice as if it was your own, and you decide. So if someone has been historically a patient that has historically kept all of their hygiene, they're in the Whitening for Life program, the Lifetime Whitening program, and they've kept all their hygiene appointments. But one day the patient calls and says, Susan, I have a hygiene appointment later today. And I am so sorry, but I need to change. I'm sorry to do this at the last minute. I know I'm supposed to give you 48 hours advance notice, but I just found out we have a new supervisor at work and she just called an emergency meeting. It's all hands on deck. And if I don't go to that meeting, I'm going to lose my job and I need to reschedule my hygiene appointment. Now, if you were the person receiving that call, we would say, Linda, thanks so much for the courtesy of your call. I totally understand. You're in our lifetime whitening program, but here's what I'm going to remember how that works. As long as you keep your hygiene appointments or give us 48 hours notice if you need to change it, you stay in there. But here's what you've been such a great patient of ours, Linda, that I am going to keep you in our lifetime whitening program. You're still in. Let's reschedule your appointment. You're still in. But I do need you in the future. You get kind of one get out of jail free card. Here it is. I'm going to let you use it today. In the future, you do need to either show up or give us 48 hours notice. Does that sound fair, Linda? And what's Linda going to say?
Absolutely. She's going to be so thankful and appreciated. Yeah.
Now, if Linda has been a serial abuser of your time, then you take her out of the program. We don't need any reporting on this. The team just needs to make a note, for future reference on who we're giving whitening gel to during the hygiene appointment, and just ask your team members to make that decision as if it were their own. And if they want to be a little bit softer on it, no harm, no foul. I would encourage them not to be a little tighter on it, because sometimes things come up. But let the team administer, empower your team members. And doctor, if you trust that team member enough to be under your employment, you should trust that team member enough to make these decisions themselves and not bother you. Yeah.
That's a wonderful question and a great answer. Thank you, Gary. The last and the fourth question is, we are that office that you mentioned that does about one whitening procedure a month.
Woohoo! Way to go. Pardon my sarcasm.
What would be an appropriate goal given our history of low whitening volume?
Yeah, I would start with five whitening procedures. First of all, that's a 500% increase. Did I do my math right now?
Yes.
And I think we'd all agree, hey, how would you like to make 500% more money next year? Oh, okay. How would I like to run a race 500% faster than I've ever run a race before? Yeah, I'm in for that. So yeah, start at 5. And maybe we put a fun bonus together. Maybe we put a fun bonus. Remember, the whitening can pay for itself. Maybe we put a fun bonus together and we say, as a team, hey guys, if we do 5 or more whitening procedures, everyone's going to get $100. Now, that's not lottery money, but I don't think anybody would object to having an extra $100 in their purse or wallet, regardless of what their economic condition is. Wouldn't you agree?
Exactly. And it's fun, right? I mean, that's the key part. It's just, if we work on something together and if it works, we all benefit.
Yeah. And so maybe we do something like that as a way to kind of get some momentum going when we've had no momentum in the past, make it kind of fun. Yeah. But I would suggest 5 would be a good place to start. Ultimately, I'd like to see you get to one whitening procedure a day in your practice based on how many clinical days you work. So you're working 17, 18, 20 days a month. I'd like you to get to 17, 18, 20. But you're not going to get there from 1 to 20 overnight. You're going to have to take some steps along the way. Hey, we got some great questions today. I always love the depth of the questions we get from our listeners. So for those of you that have submitted questions, we appreciate that greatly. They add a lot of texture and depth to our podcast episodes. Hey, as we wrap up today, I hope that I've injected some enthusiasm, some passion around growing the whitening business in your practice. It's a gateway service. Giving people what they want is an absolute formula for success. And it creates better patients that are more likely to do their home care better, more likely to keep their hygiene appointments, more likely to be interested in other dental services in your practice. And doctor, be ready when you see the patient in 6 months and the patient says, Doc, I love the color of my teeth, but what about this? What about that? What about this? And it's so much more fun when the patient's asking you instead of you having to introduce the topic. They're now asking you. And most dentists would say that they love when that happens. So this is going to happen a lot more often. Well, hey, I want to conclude by saying thanks, Naren. Thanks to you for co-hosting this podcast. Thanks to you and your team at Equa for providing our new patient flow at Life Smiles Dental Care. And now I get to see it happen with as I've been making referrals to my clients. I've seen the kind of results that we've experienced with Equa as an Equa client, repeated time and time again through my clients. If you haven't done so already, book a marketing strategy meeting, www.equa.com/MSM. If you haven't done so, I'd encourage you to do that. On that note, let me simply thank you for the privilege of your time and tell you we look forward to connecting with you on the next Thriving Dentist Show.